morning everybody, my name's Sally Moore, I'm a nutritionist and dietitian and I work at the School of Food Science and Nutrition. I'm going to talk to you about our intervention today, but before I do that, I just want to thank the University of Leeds for the funding and also the people from the University of Leeds and others who've worked on the project. So Ashna Kundra, who's the research assistant on the project, is here today, who's been exceptional in delivering this work, and Peter Ho, here from the university. Also Dr. Tanifa Apeke, who's on the right-hand side here, who's a major collaborator at the University of Sheffield, and all of the staff from and participants from Feel Good Factor who have been our community partner. So this is what the intervention looks like in a nutshell, and to be very brief, it was trying to address some of the inequalities that are experienced by people from different ethnic backgrounds across Leeds and nationally in terms of health and diet, and particularly the associations between diet and development of cardiovascular disease and obesity and diabetes, where we're looking at excess of certain nutrients of public health concern in the diet. So as an overall view, the intervention aimed to raise awareness and introduce the concept of African and Caribbean foods as part of a healthy, balanced diet. And to do that, it used two food-based resources shown here. The first is the African and Caribbean Eat Well Guide, which includes traditional and commonly consumed African and Caribbean foods within what a healthy, balanced diet looks like. And the second is some recipes that have been developed to modify traditional African and Caribbean recipes to deliver less quantity of certain nutrients of public health concern, such as salt, saturated fats and sugars. And both were co-developed with the target population here, which is people from African and Caribbean ethnicities. This one was co-developed by a third sector organisation called Hamara and Leeds City Council. And these recipes were co-developed by Dr. Tanifa Apeke, students at this university, and service users at the community partner. And that work happened some time ago. The other aim of the intervention was to get people to experience cooking the recipes and tasting and have an opportunity to prepare them together. So that's what the intervention looked like, and it was my favourite part of the last 6 to 8 months. Here's some photographs from the intervention. We went to the community partner in North Leeds and we worked really closely with Lorinda and other staff members to recruit participants from amongst service users. So we recruited 30 people and we conducted lots of intervention sessions. Many of those people from African and Caribbean backgrounds, and we were very inclusive in our approach, and some people reported they had no education and many were also female. We were quite open to voices with this project, and we collected pre and post questionnaire evaluation on opinions and satisfaction and perceptions of the sessions, but we also collected verbal data. We wanted people to be open and talk to us about what they thought about the intervention. We also recruited some staff and sought their views on the intervention as well. So in a nutshell, some of the very top line findings, and there are others, is that pre and post levels of awareness of these resources, including the healthy eating guidance, increased as we hoped for. We also found quite high levels of confidence in the participants. They reported when following the intervention in using the healthier recipes at home, including within budget. And what we were particularly pleased about is the satisfaction levels of the participants. They were highly satisfied with this intervention. So just a little bit of a word cloud to show you some of the themes or views that cropped up from participants. Many people expressed an awareness of learning, particularly in relation to the delivery of nutrients and daily allowances, and the new experience of these healthier recipes. And from a staff perspective, we recruited 10 staff and we sought those views, their views as well, which are also shown on this word cloud. And we sought suggestions from staff also, and they were very forthcoming about some further development for the intervention, particularly with regards to vegan diets and the integration of the resources into community and health settings with practitioners. So dissemination impact, if you want to have a look at the academic impacts, we've presented at the Nutrition Society, we've shared with healthcare professionals at Diabetes UK, and we've also been nominated for a community award with the British Nutrition Foundation. And you can go on the website and look at the materials on the university webpage. But really, the dissemination from this project has been through the participants and the work with the third sector. So here's my favourite photo of some of the participants using the recipes, which they also reported they'd want to do after the intervention as well. And then the recipes are freely available. They have been for some time. They're on the Leeds Foodwise website alongside other recipes that are also targeting becoming healthier. So that's it from me, and I just want to thank everybody involved in the project again, including the participants and Feel Good Factor, and for inspiration from Liz Boniface and Emma Strachan at Leeds City Council as well. Thank you.